So I'm Greg Marcus. I'm a cardiac electrophysiologist and a professor of medicine at the University of California, San Francisco. So the Holiday Monitors trial was an attempt to try to get at a phenomenon that patients have long reported, but that has been difficult to objectively elucidate. And that is a temporally sensitive relationship between alcohol consumption and atrial fibrillation, specifically to test the hypothesis that acute alcohol consumption would enhance the chance that a discrete atrial fibrillation episode would occur shortly thereafter. So we enrolled 100 individuals with paroxysmal atrial fibrillation. We fit them all with a continuously recording ECG monitor for a month. We instructed them to push a button on the monitor whenever they consumed one standard drink. They were instructed that such a standard drink would include a glass of wine, a 12-ounce can or bottle of beer, or a shot of hard liquor. We also fit them all with a transdermal alcohol sensor around their ankle, and recognizing that this might promote a sense of stigma, we put a UCSF Cardiology sticker on there quite prominently. And then we saw them back every 2 weeks, and every 2 weeks we also obtained a blood spot for a compound called phosphatidyl ethanol, which can be thought of as a hemoglobin A1C for alcohol consumption. It reflects alcohol consumption in the previous 2 or 3 weeks, and it was a way to validate those button presses, providing the patient activation, indicating real-time alcohol consumption as an independent way to examine this relationship between real-time alcohol consumption and AFib, separate from the transdermal alcohol sensors that also provided objective evidence of real-time alcohol consumption. So we found that one alcoholic drink predicted a twofold or greater than twofold heightened risk of a discrete atrial fibrillation episode occurring within 4 hours after that alcohol was consumed. If someone drank 2 or more alcoholic beverages, they experienced a greater than 3.5-fold higher risk of a AFib event acutely happening in the following few hours. We then validated that with the alcohol sensor. So looking at either peak alcohol levels from the alcohol sensor or the area under the curve of alcohol that was sensed, that also separately predicted a near-term atrial fibrillation episode. So these findings provide, I believe, fairly compelling evidence that acute alcohol consumption raises the risk a discrete atrial fibrillation episode will occur. This is something that our patients have been reporting for a very long time, but it's been difficult to study because it requires ambulatory monitoring, and modern technology finally has gotten to the point that it enables us to perform this study in an objective fashion. It's important to acknowledge that these were all individuals who already had atrial fibrillation. So a common question is whether we can extrapolate this to the general population, or to what extent we can do so. And the honest answer is we don't know. This does provide the proof of concept, though, that when an atrial fibrillation event occurs, which is commonly attributed to just random chance, appears to have at least some determining factors. And interestingly, those determining factors may be something modifiable and directly under the control of the individual patient, in this case, alcohol. It also tells us, combined with previous data regarding chronic alcohol consumption, and the majority of research in this area has focused on long-term patterns of alcohol consumption related to long-term effects on AFib. And the kind of the novel contribution of the current research is to demonstrate this near-term acute relationship, but it adds to this growing body of evidence for our atrial fibrillation patients that to minimize the risk of AFib recurrence and likely to minimize or reduce their burden of atrial fibrillation, that reducing alcohol consumption or alcohol abstinence may be the best thing for them. Now, a common and very reasonable question is, well, alcohol consumed in moderation and consumed responsibly is important to many patients' quality of lives. And so it's important that we aren't naive to that and that we don't simply ignore that. So there's a lot of research yet to be done related to whether therapies for atrial fibrillation, especially ablation, for example, whether that's sufficient to render one no longer vulnerable to an alcohol AFib relationship. The other really important unknown is the net benefit versus risk of drinking in moderation. It's always important to emphasize that the data is very clear that no matter what outcome you look at, heavy drinking, binge drinking, drinking in excess, generally more than 2 standard drinks in a 24-hour period, is almost certainly detrimental to health in multiple ways. So the unanswered question is really regarding the light or regular moderate alcohol consumption in terms of overall health. Given some evidence, there may be some benefits in terms of heart attacks, in terms of diabetes, even in terms of some cancers like lymphoma, versus the risks such as atrial fibrillation, hypertension, obesity potentially, and other cancers such as breast cancer and colon cancer. And this is precisely why studying alcohol and the heart and overall health is so interesting, because it's so ubiquitously consumed and because it has these very complex effects. But circling back to our AFib patients, again, for those individuals, especially if they're interested in doing everything they can to reduce the chance that they're going to experience an episode, it makes sense to try to minimize alcohol as best they can. So next steps are to perform additional studies. And there are multiple branches that arise, I think, from these findings and those of other research in this area. One is to understand when we do have a patient that clearly is being harmed by alcohol, how to best message that, how to help them implement effective behavioral change. Another area of research is to examine therapies for atrial fibrillation, such as catheter ablation, to determine if that's enough to rid patients of alcohol as an important risk factor for events. Third is to identify those who are more or less susceptible to alcohol-induced AFib. There's almost certainly heterogeneity here, where clearly some people who never drink alcohol in their lives, they still get AFib. There are people who drink tremendous amounts that never get AFib, and then there are people somewhere in between. And so identifying the genes, the other exposures, the other behaviors that may be important in influencing these relationships will be important. And then finally, ideally, a randomized trial to truly understand whether moderate alcohol, responsible moderate, regular alcohol consumption is overall beneficial or harmful for the great majority of the population would be useful. So I would say the take-home messages are several. Number one, that we should no longer consider the timing of an atrial fibrillation event as determined only by random chance alone, but should recognize that there are environmental factors, behaviors, exposures that can likely heighten the risk that such an episode occur, which itself suggests there may be other exposures, behaviors that may reduce the risk that an AFib episode may occur. It also may be that trigger is idiosyncratic for a given individual. So understanding a given patient's individual triggers may ultimately prove to be important in helping them manage their own disease and helps to empower them to identify modifiable exposures that they have control over. The other is that as far as within our patients with atrial fibrillation, alcohol does appear to be an important determinant, not only of the initial diagnosis of the disease, but now with these data, with the risk that any discrete episode will occur. And therefore, for our atrial fibrillation patients who are interested in doing what they can to reduce their risk of AFib, I would recommend minimizing or abstaining from alcohol.